Hey, it's Dr. Gonzo, and you're watching In a Nutshell. Today I'm going to talk to you about what mitral valve stenosis is. There are several conditions that we know in medicine that can cause mitral valve stenosis, but the two most common ones are rheumatic fever and endocarditis. Endocarditis is simply the term that we utilize to explain or describe an infection of the heart. Now remember how I showed you the last couple of episodes what a normal mitral valve looks like? Well, this is what happens when you have a disease like rheumatic fever affecting your mitral valve. Instead of having nice thin tissues like the ones that I've tried to draw both from the side and from the front of the mitral valve, this is what happens with something like rheumatic fever. Scar or thickening affects the entire mitral valve apparatus, and the valve basically gets encased in this really dense inflammatory scar. This is what it looks like from the side. But if you look at it head on, both leaflets are thickened and ruined by this process. Now you can imagine, rather than having really nice pliable tissues, the scar and the thickening causes the mitral valve aperture to diminish. So rather than opening throughout the entire area of the valve, now the blood needs to be pushed through a very small aperture, which is affected by this scar tissue. And so that's mitral valve stenosis in a nutshell. Keep on watching. There's more to come.